Hello and welcome, ladies and gentlemen, to our presentation of palliative care sponsored by the Las Cruces Palliative Care Coalition. My name is Terry Meyer. I'm a physician and the chairperson of the coalition. I have long been interested in supportive care for patients with chronic serious illness. However, over the past few years, I've become more interested in the modern day definition of palliative care. Typically, hospice patients are required to accept the concept of terminality or limited life expectancy and are expected to forego any cure-directed therapy or life-prolonging therapy. While this might be an easy exercise for some patients and their doctors, it becomes quite an existential dilemma for a certain percentage of patients. Thus, palliative care has evolved as a response to this dilemma, as well as additional reasons. Now, let me share some of the general characteristics of palliative care. Clearly, as mentioned above, there's no requirement to be terminal or forego any cure-directed therapy. In fact, we advocate that palliative care starts at the beginning of a diagnosis of a chronic serious illness. Palliative care provides an extra layer of support, including a holistic approach to the care of the patient, addressing not only the physical, but the psychological, social, socioeconomic, and spiritual dimensions of the patients. It clearly emphasizes a team approach. Communication skills are greatly emphasized in palliative care. While the patient and family members might expect healthcare providers to have excellent communication skills, these skills are extremely important, especially when dealing with patients with chronic serious illness, as well as breaking bad news, if you will. We also assist the patient in defining their own healthcare goals. We advocate that these healthcare goals be respected by the routine healthcare delivery system. Additionally, the concept of quality of life versus quantity of life is extremely important in the palliative care picture. We constantly reflect on the issue of not only what could be done for a patient, but what should be done for a specific patient. Patient satisfaction, family member satisfaction, and caregiver satisfaction, as well as referring physician satisfaction, are an important dimension which we address routinely.
Palliative care is a specialized type of healthcare. In palliative care, we focus on the patient's quality of life as they work through their curative therapies and treatments for their serious illness. Palliative care consists of a team of qualified healthcare professionals that work together to support patients and families in any way that we can. For example, at Memorial Medical Center, our team consists of myself as the physician, a clinical pharmacist, a nurse practitioner, a social worker, and a chaplain. Together, we all help patients deal with multiple needs. These include symptoms from treatments or diseases. These include things like unmet social needs, psychological or spiritual needs. And we also help patients and their families plan for the future. Palliative care does not take the place of your other healthcare professionals. Instead, we work together as consultants to help support your healthcare professionals as they help you with your disease. Our medical system has become increasingly complicated, and it can be difficult for patients and families to navigate when they're faced with a serious illness. Palliative care is there to walk with you along the way.
Receiving palliative care does not mean you are dying. Ideally, palliative care starts at the beginning of a serious chronic illness. At least 12 million adults and 400,000 children have serious chronic illnesses such as metastatic cancer, severe dementia, heart failure, and serious congenital illnesses. While hospice specifically is palliative care at the end of life, it's only part of the palliative care picture. Hospice care is the smaller circle representing end-of-life care, while the larger circle represents palliative care potentially valuable to approximately 4 to 5 times the number of patients who are eligible for hospice care. While palliative care takes into account the disease, it's not about treating the disease. It's about treating the person. It's about helping symptoms and helping improve quality of life. Of course, palliative care is not about shortening life, but it's not specifically about prolonging life. It's about making each day as good as it can be.
I was trying to remember exactly, but it was in August or September of 2019. I was in the hospital after cancer treatments for the vocal cord cancer, and I was really down. I had lost my voice. I just had no strength. And I believe, Tracy, you walked into my room. I'm not sure, but that's how I remember. And they asked if we'd like to see you, if I would like to work with a palliative team. And you explained a little bit, and I said yes. And that started this journey. And it was very, very helpful for me. I even feel emotional when I talk about it, because the support you gave me, I didn't get from anybody else. And you worked on all of us, from Dr. Short. Thank you. I've never properly had time to say thank you. But after that, I started getting stronger. I was able to set some goals. And my cancer's in remission. I may never get my voice back, but okay, I can deal with that. And you visited with me, with my daughters. I just love you all.
Most people don't know about you. The work you do is tremendous, giving people hope. Being hospitalized with complex medical issues frustrates people. They get angry, they get depressed, they get anxious. They don't understand quite often what's going on. And your team is able to step in between the professional medical people and the patient and try to bring some organization, some sense to what's going on with the patient. I know with Anita, you did several things, but probably what you did most was to give her hope that her future would be better, that things would get better. And with the professional team you had, you could deal with individual issues she had, medicine, medical treatment, aftercare at home. All of this was very important to her, and with your team being able to assist her in all these ways, like I said, it gave her hope that her future would be better. I don't think you could have done more.
Not for us, but maybe somebody else. But you gave us hope, and you worked with remember meeting and you give us, I can't think of a better word than hope, but maybe a path. Because as you probably remember, I had that feeding tube inserted, which is one of the worst experiences of my life. I kept it in 2 months, but I don't think I would have kept it in. I couldn't have used it without you explaining to me what was going on. And that's what you do. She came out to our house and she just talked to me as a person about what I was struggling with. She brought me a beautiful Bible. And I don't know, I hadn't been very religious before then. And now I feel that I can pray and be understood. Now, everybody has their own individual talk with God or beliefs. But my beliefs have given me peace that I didn't have before I saw Dr. Short. And every night I give her a hug, as I give you all a hug. I'm thankful to have you in my life. And I know I can pick up the phone and call you. And we've done that recently. We've reconnected because I've got new problems. And I need to see if you can give me a better understanding of what's going on. So yes, I think Dr. Short, I think all of you saved me, saved my life.
Well, like I had indicated, and like Anita said, the service you provide is extremely valuable to patients today. What you offer, what you provide is, I see, extremely important to helping the patient get better quicker.
My name's Julie Reyes. I'm a palliative care nurse at one of the local hospitals here in Las Cruces. I've worked with many families over the years that have been dealing with serious illness, and I've guided them and their families through difficult decisions. However, I would like to talk to you a little bit about my own personal experience with my dad. My dad is a Vietnam veteran, and he suffered a serious back injury about 30 years ago that developed and left him with severe pain and neuropathy in his legs and hands. My dad came to live with us a few years ago, and I was able to watch how that pain impacted his daily life. There were times he stayed in a dark room all day and just tried to get through the misery of his pain. It was very difficult to watch because this is not how he envisioned his retirement years. I was able to set my dad up with a palliative care provider here in Las Cruces. And after all the appropriate testing was done, my dad was able to be started on a pain regimen. The neurosurgeon was able to set my dad up with physical therapy, and after all these things were completed, he was able to start doing things that were important to him in his retirement years. Although my dad's condition wasn't life-threatening, we did decide to complete an advanced care directive, or goals of care. And while as a palliative care nurse, I've helped guide many families and patients through these decisions, I had not yet done this with my dad. We were able to have many discussions that talked about what he would want in the event he was no longer able to make decisions for himself, and I needed to step in and make those decisions. We talked about things like CPR or cardiopulmonary resuscitation, being on a ventilator, being able to eat or drink, or having to be fed through a tube. We talked about how things would look if he were not in his normal state of health, and what he would want done if he were wheelchair bound or bed bound or developed incontinence or any other multitude of symptoms that we find ourselves dealing with as we age. I was able to determine that my dad had never really thought about himself other than as in his current state. And having this discussion, although tearful at times, we were able to move through the different decisions he would want if he were not able to make those decisions, what he would want me to do for him. I want to reassure you that you don't have to be a palliative care nurse in order to lead this discussion with you and your family. There are many resources online. Prepare for Your Care or 5 Wishes are some of my favorites that help guide you through the document. And oftentimes there's videos that will guide you through how to have these discussions, because these are very difficult discussions to bring up, and I think it's important that no matter what happens, that you have the discussion.
Las Cruces Palliative Care Coalition is an organization of healthcare professionals. We meet once a month to educate ourselves about the value and the excellence of palliative care. It's our hope and our intention to share this information here in our community of Las Cruces. Our mission with the Las Cruces Palliative Care Coalition is not only education for our patients and their families, caregivers, and other healthcare providers, but also to talk about the benefits, what the real value is in helping to decrease the pain and the suffering that comes from severe illnesses. I want to talk about some great reasons why palliative care makes sense for Las Cruces.
Palliative care attends to the physical, emotional, social, and spiritual needs of patients and the families who care for them.
Palliative care has been shown to reduce 911 calls and hospitalizations.
Palliative care offers another level of support for people dealing with chronic illness.
Palliative care focuses on improving the quality of life for patients and their caregivers.
Every patient, as well as their family members and caregiver, are worthy of respect, honor, and esteem.
So if you're wondering, gee, how do I get some of this palliative care? We would encourage you to talk to your healthcare provider to see if palliative care is a level of care that would be important and also making some sense for you. You can also find us at www.lascrucespalliativecare.org.